Welcome back to Waking Mad. I'm Ben Bruce, and as you know, at Waking Mad we love to have interesting guests, and today we have a fascinating guest. I have the privilege to talk to Dr Kennan Taylor, who is a medical doctor and a psychotherapist. Just to get the ball rolling, Kennan, you decided to leave medical practice not too long ago and reconnect to your ancestral traditions in health and consciousness and psychotherapy. Such that you now call yourself a medicine man. I just thought you might let us know what was going on with that. You left this mainstream job, very important job, and moved into this, ancient tradition. What was all that about?
It probably wasn't as sudden as it sounds, actually. It might have been to those who were affected by it, including my family. But the actual move was a culmination of a long period. For well over 20 years, probably longer, I'd been interested in spiritual aspects of medicine and health and my own spiritual development, and had explored those in various ways, not just in medicine but in psychotherapy, Jungian analysis. I trained as a Jungian analyst. But this seemed to run a parallel path. So I had almost a dual life where I was a medical practitioner at one level, and on the other hand I was also fascinated with traditional and contemporary approaches which had a traditional sense to them, sensibility to them. And I, for the latter part of that period, while still a practitioner, I also developed a property near Albany, which we were, and still are, intended to use as a health retreat, where we could probably employ some of these methods. And what I was hoping to do was to be able to take some of these influences back into mainstream. Mm-hmm. But I found that created quite a division. There were people who were fascinated with it, who were usually on the minority, and then there was a fairly large contingent who showed initially passive and then progressively more active resistance to it. And it just got to a point where the conflict of those positions really were having a deleterious effect on my own health in particular, and were basically in the view of the establishment and institutionalisation in general. And it was a very stressful period of time. So I made a decision that my more spiritual interest in health and personal development and consciousness research was the main interest that I wanted to pursue for the remainder of my life. And that maintaining a medical career at the same time was not going to work, and trying to take that back into a medical career wasn't going to work.
So we often have this sort of dichotomy, an unbridgeable chasm, you could say, separating the mainstream, you would call it scientific, materialist, reductionist paradigm, or just mainstream bureaucratic government type stuff. And I think medicine is very bureaucratic these days. and a chasm between that and, I gather you call it traditions, healing traditions or spiritual traditions, a chasm. And so you were actually trying to straddle, to traverse that dichotomy.
Well, I basically was seeing that Western medicine was in a bad state. It was too scientific, it was too technological, it was too disinterested in patients' emotional welfare. And what I felt was, right from an early stage, before I got this interest became actually rather more consolidated, was that there needed to be a reinstatement of those sort of values, like the value of the healer, the health professional, his role, her role with their clients and patients, and more of the dialogue between doctor and patient, more of a recognition of different settings and ways of managing problems that weren't just drug and technologically oriented. That was the thing that started me off. And when I was starting to use that in more and more, recognise that to be something I wanted to integrate in medical practice, it caused some initial stresses, which is when I went into psychotherapy, initially for my own welfare, but later to train, and then more into mental health realms, because I felt that was the area that could probably explore these different patterns and would have an avenue back into mainstream Western medicine. Little did I know until I did psychiatry that psychiatry is probably the most moribund of all the medical disciplines. I actually don't believe it should be a legitimate part of the medical lexicon, really. I think the whole sort of psychological and psychotherapeutic area needs to go in different channels. I mean, that's a personal view, I think, but I think the role of psychiatry is quite limited.
And I gather one of the reservations you have about psychiatry is what it does to the healing art.
It blocks it. It effectively gets in the way. It effectively, I mean, unless the practitioner themselves is aware of other depth approaches or has got their own experience of health and healing, then there is quite a tendency for psychiatry to serve the collective norm. So largely the approaches, and in particular the drug-oriented approaches, tend to be controlling, tend to be satisfying society's expectations and fears, rather than listening to and understanding what the person who's suffering mentally is going through. So the actual health and healing process is blocked. And that's why I kind of left psychiatry. But also I'd always maintained that we shouldn't have a mind-body split. And one of the things that I felt in psychiatry was there was an ignorance of the physical side of mental distress and a need for that reunification. So I went back into mainstream and felt like I could still continue to bring these interests in. But as I progressively got more involved in areas like anglo-saxon medicine, druidry, the whole area of retreats, the whole area of initiation, ritual, ceremony, use of things like sweat lodge, areas like where do psychedelic medications and drugs fit into the whole picture.
As opposed to mainstream psychotropic.
Oh yeah.
Which is consciousness reducing, whereas psychedelic is consciousness expanding, isn't it?
Yeah, I think there's a big difference between what Terence McKenna calls the sort of botanicals and the herbals. You know, they're God-made in his terminology, and well, not his terminology, my terminology, and they are available to us and we have a right to them. They're very different from chemicals that are manufactured with specific aims in mind.
And patents.
And patents, and the control that goes along with those, and also because they're directed toward dealing with the problem, not helping a person find a solution. So if somebody's manifesting distress, then the medications are used to quell the distress, not to actually foster what the distress may mean and where it may take them. And psychedelics do that. They take people into that area and through it.
They squeeze the psychic cyst.
Something like that, and they make it fairly painful for a while. But
it can be very painful when you have a psychotherapeutic experience or a cathartic abreaction, or you have indeed a psychedelic trip. It can be very painful, very difficult.
I think you're quite right. You've identified something quite important, that psychotherapy can have this dualism too. That on one hand it can be employed to just quell everybody's nerves, concerns, the worried well and the worried families, partners.
Yeah, who's your client?
Yeah, exactly. Who are you fixing and why are you fixing them? Yeah. As opposed to somebody who's whose anxiety represents a desire to go into a healing journey.
And you probably noticed, I say tongue-in-cheek, that psychology has been now brought into the umbrella, the purple circle, the welcoming arms of the medical establishment.
Well, there's a big difference, as you know, between sort of academic research and clinical psychology and depth psychology. Yeah. You know, I think that sort of chasm between the two is also true in medicine. There's a big difference between Western medical, scientific, rational, disease-modelled, protocol-ridden, institutionalised medicine, as opposed to medicine which is traditional, generic, which is inviting of deeper forces involved in the healing process to be evoked and involved.
So I gather your chagrin with psychiatry and the reason why you exited that specialty and went back into general practice / psychotherapy?
Yeah, psychotherapy, and also I had a fairly restricted general practice. I would see people more in a holistic setting. Yeah. So I would employ various methods which were marginal with mainstream. I'd use intravenous approaches with things like vitamin C, chelation therapy. I would take a much more nutritional and environmental orientation, because these were compatible with my fundamental beliefs about health and healing. Yeah. And I tended to avoid using medications unless deemed really necessary.
And what's the main reason you'd avoid using medications?
I have some deep reservations about the pharmaceutical industry in general. I think we've developed a armoury of tools which we don't really know the full effect of or significance of. I think we've...
like side effects?
Well, they're foreign. I mean, we've stumbled onto alchemy and we've taken it away from its mystical roots. And we've got just the chemistry, and we've got an industry which then is trying to refine these chemicals to make them more effective, like a magic bullet, but in so doing makes them more foreign to the body and poisonous. And I think in short-term circumstances, like in accident and emergency medicine, or if somebody's going to die of pneumonia tomorrow, they're brilliant. But used long-term or routinely, or to just quell anxious symptoms or troublesome symptoms, or to adapt to an occupational flow, family flow, other people's expectations, or because fundamentally we fear the consequence of the symptom, then I think we're in difficulty.
So you could say that the problem, therefore, with Western medicine largely is that it's overextended itself. It's tried to control the human condition, to treat everything. The way it wasn't really designed for that.
The way I simply see it is that medicine's become pathologized and lost its roots with physiology. So it's lost its connection with normal bodily functioning and tended to identify everything in terms of pathological bodily functioning or mental functioning. So that if someone has a symptom, instead of understanding it as being a variation of normal or an attempt on the behalf of the body to address a problem, it sees it as an indication of a disease process and goes down that particular rabbit hole.
And that's a biased paradigm, isn't it?
It's very biased.
Yeah, I was reading...
and it's wrong.
Indeed. I was reading the thoughts on this by an alternative doctor, much like yourself, still probably struggling with mainstream. I forget his name, sorry, but it'll come to me later. And he said the problem with medicine is that your first introduction to a patient is a corpse.
Absolutely.
And therein the bias begins.
And there's even another level to that. The first time I saw a patient was in a London teaching hospital. Right? Now, if you see a patient in a London teaching hospital, you know bloody well they're sick, because they wouldn't be in a London teaching hospital unless they were sick. So the bias is anybody who comes to see you is sick. And you actually leave the whole training process with that in mind. It was a rude shock to me to go into general practice and realise that the vast majority of people who came through the door weren't sick. And if they were or complained of being sick, they were using that as a way of having contact, as a way of getting a need fulfilled, and they identified being sick as a way of being heard. So there was this translation thing going on, and it was at many, many levels, and that's really what initially rocked me. Here I was sitting in general practice, seeing 20, 30, 40 people a day and not seeing anybody who was really sick.
Wow. Before this overreach of Western medicine, who would have performed that function instead of the general practitioner doctor in the past? Who would have been there to listen?
I think, well, there's always been a stream of medical practitioners, as we well know, but whether you actually call them medical practitioners or not is another thing. I think that there was a lot of other groupings who fulfilled different and more holistic functions.
Well, I'm just wondering if we might have gotten rid of them all. And so not many of them were left, and so the doctor was the only person one could go to.
Well,
especially with
the function of nurses has become diminished. The priest has become relegated. Even the folk practitioner, which I even remember from my youth in England, is largely gone now. The person who's got natural abilities to be able to read and understand symptoms. People in social settings like villages who would understand the value of nutrition and herbs, and use them and employ them in broths and soups and rehabilitative programs.
Is that kind of your proverbial witch?
Not the proverbial witch per se.
The herbalcraft person?
Yeah, it's a thin line, isn't it? It's very easy to be able to see people that way, but that was largely a construct of the church as a way of being able to control the population from the pagan influences, which were still around and are still around and have never gone away.
However, as a victim of our history, they were largely gotten rid of.
They were largely gotten rid of. They were mainly women, and they had a strong association with what's known as folk medicine.
Yeah.
They practiced it. So those factors and the vehemence with which they were treated is an indication of the desire for control of the religious organisations and the fear they had.
Just before we get into how you got into folk medicine and what inspired your journey there, can you just tell us about your conventional journey? Where did you start with your training? Because you mentioned your introduction was more physiology rather than pathology.
Well, I did a degree in physiology at Oxford first, and then completed my medical degrees in London. And then my family were over here, so I came over here. Was going to pursue a specialist career, but decided to go into general medicine for a while and find out what it was all about and get a little bit more experience. So I was a general practitioner for several years. And then, because of the reasons I told you about, and becoming more interested in emotional and mental aspects of health and the turmoil I was going through with a broken marriage at the time, I went into personal psychotherapy, and as a result of that, went into the Jungian tradition and trained as a Jungian analyst, and then practiced for 10 years as an analyst.
Is Jungian psychoanalysis what got your fires going?
What my juice is going.
Yeah, with regards to alternative traditional medicine.
It formalised it. It gave it shape. I mean, what for then had been just nebulous and around the place in medicine generally, and I was picking up in interactions, took shape in a more sort of historical and mythic sense. I sort of discovered tradition and saw that a lot of the turmoil I was experiencing has been present in one form or another, and has been part of an ongoing inquiry that goes back forever.
When did you first get that inkling? Was it before Jungian psychoanalysis training?
No, it's through it. I went into the Jungian training not to train. I went into it because of my own personal turmoil.
Okay.
But as a result, I became interested in it as an art, as a method of psychotherapy, and it continued on. And as I got more deeply involved in it, then I started to see the relevance of my own personal history, my ancestry, myths, mystical traditions, magical approaches, folk traditions, that whole mixture of things. But that at that stage was very ill-formed, because I still saw myself very much as being a Western medical practitioner. So that's why I tried psychiatry then, but found...
However, Western medicine was different then.
It was more like the things that I'm interested in, and it had roots in it, and it was certainly more available to experimentation, bringing in new ideas, taking risks. Whereas now it's governed by protocols. The individual practitioner these days doesn't really have much freedom.
So when did you do your training in medicine? What was the era?
70s.
70s.
Yeah.
So in the 70s, I take it, as a doctor, you had far more discretion and professional freedom.
Yes.
You were able to think for yourself.
Yes.
And really think about what would suit your patient best, rather than ascribing to protocol.
Absolutely. You were taught that way, or I was taught that way, but I was in a very venerable institution. It was London Teaching Hospitals, Oxford University, and the emphasis then was on evaluation, inquiry.
Would you say the major difference, I don't want to be too reductionistic, was that, though, was it idiosyncratic medicine as opposed to nomothetic? Is that where we've gone? Have we gone to a one-size-fits-all, whereas back then there was more appreciation for individual differences?
We've objectified medicine, really, in a nutshell. We've made it into an objective art's the wrong word, science, governed by drugs, technology, institutionalisation, protocols, and the individual practitioner doesn't have freedom anymore. I mean, medical legally doesn't. It's governed by those sort of agencies.
So considering you were basically practicing for what sounds like 30, 40 years, and you saw the profession change in that time up until the noughties or teens of the 21st century, how would you say the doctor might feel differently nowadays as opposed to when you started?
I don't really know. You don't get much access to people in training these days, as we've discussed elsewhere. The training of GPs now has added yet another level of that sort of objectification process to the mix. I went out into general practice almost immediately after I qualified, after I registered. So I was blooded with experience and learnt very, very quickly with people being mentors around me and guiding me and helping me and learning from them. Whereas now I think the the medical practitioner training, and probably in the youth of today, is very isolated, certainly emotionally isolated, governed by what they're doing, and they're basically a technocrat. They computers rule, protocols rule.
The doctor is a technocrat.
Well, effectively. I mean, science breeds technology. It doesn't breed the art of medicine.
It's also not so much a privileged position anymore. The doctor, when I was a lad, was always, this sort of exalted standing in the community. I know, for example, doctors earned far more money then. A lot of the wine region of Margaret River was started up with spare cash flow that doctors had, and imagine how many doctors would be going around starting up wineries now. I doubt it. So there's almost been a devaluing of the doctor, hasn't there?
I think what's happened is that medicine's become contracted to health modelling and the science of that, and hence the technology of that. And even that's a restricted modelling. I mean, I'm interested in Ayurvedic modelling of traditional Chinese medicine, anglo-saxon medicine, lots of different modellings. And that's one thing. But the thing that I think is crucial is the value of the relationship between the doctor and the patient, and the value of the wisdom of the doctor himself or herself has diminished and even been extinguished to a large extent. So the art of medicine and the non-physical things that transpire between a doctor and patient have largely been excluded. And as you well know, we both know that a lot of the real healing comes with non-verbal interactions, and sometimes with things that are said in dialogue and in risks taken in the encounter, even with just verbal approaches to different things and challenging people. That area of the relationship has been diminished and almost flattened out of any sort of relevance. Also, the settings change. I mean, this in times gone past would have been a doctor's surgery, comfortably.
Yeah.
You won't find it there now.
No.
Plastic chairs, computers, formica, blah, 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 pusey walls, the sort of situation. But most significantly for me, there is no avenue for the non-physical, metaphysical entry. We can't introduce soul.
But that doesn't exist, Ken.
I know it doesn't exist, or it's told it doesn't exist.
I gather this is the objectification you're talking about.
It's very much so.
Yeah.
I mean, for me, medicine is an art and it's soulful.
Right. So you were very much against the grain, or the contemporaneous physician.
I think I always was. I mean, my background was farming. So my father was a farmer. I got used to life, sex, birth, death. We saw it in the animals, from the rabbits to the horses to the sheep to the pigs to the cattle to the dogs to.
And you're also in the south of England, weren't you?
In the Midlands of England.
The Midlands of England. So I gather there was still something of the druid pagan traditions in the farming communities, as far as I'm.
There was, and then there was kind of a folk type of mentality.
Yeah.
People treated medicine amongst themselves in a little bit like they treated the animals. They had a veterinarian sort of approach to it. The object was to stay well, the barefoot medicine type of thing. Yeah. And we didn't consult the doctor if we sprained our ankles, only if 2 days later you couldn't walk on it.
It'd have to be quite bad.
You'd have to be quite bad.
So in this day and age, we're seeing doctors too frequently, I gather.
And for the wrong purposes.
Being over-treated, therefore.
Being over-treated, over-managed, medicalised, and also pathologised.
Yeah.
We're also using doctors for things like off-work certificates.
Yeah, you just become a bureaucrat.
Yeah, and so there's a lot of bureaucratic elements going on in it.
Yeah. And so I think it would be good to explore how you developed your practice in traditional medicine to become the medicine man you now are. I'm thinking of Sean Connery, in the Amazonian wilderness, discovering the cure for cancer, the plague of the 20th century.
Well, we'd love to do that.
But I'd like to explore in part two of this enlightening interview, if we may, how your practice as a medicine man developed.
Look, I'm more than happy. I feel at times, even while we've been talking, this can sound a little bit like doctor bashing, and I'm kind of reluctant to do that. I hold a lot of softness of my heart for the art of medicine. And I realised the difficulties that doctors are really under.
Yeah.
And
Doctors
that's
are
suffering.
people too.
They are people too,
And we often forget
suffering.
that. Yeah.
And they have an increased amount of mental health problems, suicide. They die younger, most probably. They're struggling.
Yeah.
They're struggling, and
Sure.
that's really. And I felt that myself in my own journey.
Well, I gather up to and including why you left it altogether.
Absolutely.
You couldn't straddle it any longer.
Absolutely. I'd be surprised if I stayed in medicine where I'd be alive today.
Really?
Yeah, I really
It
do.
might have killed you.
It might have killed me.
Well, thank God you left.
Thank you. And that's why I'd be more than happy to enter into the other dialogue.
Sure. But just to qualify, I'm not doctor bashing either. And I think you were very compassionate in the way you described it. You said doctors are very good for treating, especially emergency conditions and whatnot. It's just that this overreach occurred, this objectification occurred, and this reductionism, I gather, this positivistic material reductionism, and I gather that's where everything went a bit south. But,
Yeah, progressively so, but it's got to a crisis point.
yeah.
It's got to a
And maybe
crisis.
what we need to do now is redelineate the profession and say, look, that's not what Western medicine's good at treating. This is what it is good at treating, with all due respect, and how do we do that? That might be a point of departure, a way forward. So let's discuss this and other topics in the next episode of this series, and we'll see you soon.